Good morning, this is Dr. Selvam again. I've done a series of videos on the current pandemic, COVID-19. Now there's a lot of fear, there's confusion, there is a lot of psychological stress. Thousands of lives have been lost. So it is not just human suffering and loss of human lives that I'm talking about. The effect of the current pandemic on economies of countries, especially the developing countries, is going to be disastrous. So basically, the solution lies in just one simple fact. Why are animals not suffering from such infections and as well as other infections, including cancers? And why we humans are suffering? Basically, the reason is very simple, but unfortunately, it has been withheld for all this time. The reason is simply a cheap molecule called vitamin C. Animals can make their own vitamin C and they increase during illnesses. We humans have lost the ability to make our own vitamin C, which I have already explained in my previous videos. Now, from 1940 onwards, there has been many doctors who have used high dose of vitamin C to treat infectious diseases. And they've all had fantastic successes, including completely curing polio infections. Now, no matter how much we emphasize on the truth of the matter, they are always brushed aside for various reasons. That they are not controlled studies, there is no evidence, it has not been proven. But let me ask this question, and this question is also a plea to all of you, especially heads of nations and those who have the power to make the right decisions. Make the right decision for a cheap, effective and quick remedy, vitamin C. Let's look at vitamin C. As I mentioned, we do not make vitamin C. So it has always been disagreed that vitamin C helps. We are always demanding for evidence, evidence and evidence. And we want evidence-based medicine. So let's look at the evidence. All the studies that has been done since 1940 are evident enough. If this is not sufficient, let me quote two wonderful gentlemen from China who has done the recent trial of high-dose vitamin C. Now, this is not an easy decision. Somebody wouldn't want to put in so much of effort, risk their lives to carry on treating patients of COVID-19 because every one of us want to protect ourselves. Now, one such wonderful person is Dr. Mao. He is the head of the emergency medicine department in Tongji Hospital, Shanghai. And the other is Dr. Wang, also from Shanghai. He is the professor of critical care medicine. Now, these are by no means ordinary people. And they don't make statements unless they have evidence to support what they are saying. So China, as all of us know, is where Corona started, or the COVID-19 started, and unfortunately, many lives were lost. So among all those infected, Dr. Mao and Dr. Wang decided to try high-dose vitamin C, which means intravenous vitamin C, in about 50 patients. Now, the report is still being analyzed and the final report will come out soon. But in our interview with him, we belong to a society called Orthomolecular Medicine Society, and we had the opportunity to join the interview with these two wonderful human beings. Now, what was disclosed is this. The trial was done on about 50 patients, and the dose was between 10 to 20 grams of vitamin C, not milligrams, 10 to 20 grams. 10 grams was given to those who had moderate infections, and 20 grams was given to those who had severe infections. And what was the result? All 50 patients fully recovered without complications. All 50 patients were sent home sooner from the hospital than those who did not receive. And the rest of the morbidities were also corrected at the same time. So what we are saying is vitamin C alone in such patients may not be sufficient, but this makes the difference. This makes all the difference between supportive treatment, like for example, patients who are infected with COVID-19 are likely to have a condition called hypercoagulability of the blood, which means the blood tends to be very thick and that disturbs the oxygen carrying capacity of the blood. So this is a cofactor that increases the morbidity. So physicians who attend to such patients, they take care of all the cofactors, the factors that are affecting the health of the patients. While all this being addressed, this is a group where vitamin C was given as opposed to a group vitamin C was not given. So as I mentioned, the patients fully recovered and were sent home earlier. Now, if this is not evident enough, I'm not sure what else will convince all of you all who are listening to this video to try vitamin C. Let me put it this way. The body only asks for natural compounds to heal itself. This has been known to us for centuries. Ancient treatment methods, Ayurveda, the Chinese traditional medicine, or any other ancient traditional medicines, always believed in natural compounds that can heal our body. There has been no doubts about this. Vitamin C is very much natural. Vitamin C is very cheap, extremely effective, quick, and can bring fantastic improvement in people who are infected with this virus. So it can save lives, it can help in the healing and reversal of the conditions, and it can save economies. So don't you think that it is time we accept the truth about vitamin C? Of course, vitamin C is not the only immune booster. I have mentioned about glutathione, vitamin D as well as the main pillars of our immune system. But the difference between glutathione, D and C is this. While they all work to prevent infections and keep your immune system robust and strong, vitamin C acts very quickly. This is why intravenous high dose of vitamin C is always emphasized in acute infections, including cancers. And there is a huge difference between drugs, vaccines, and vitamin C. Now, it is a knowledge, medical knowledge to most of us who are trained in integrative medicine, that patients who get COVID-19 infection and unfortunately die, they don't die from direct insult of the virus, but an indirect insult that causes acute respiratory failure. Now, this acute respiratory failure is because of the free radicals that are generated by the virus. Vitamin C scavenges the free radicals, and it has many other benefits. It boosts your immune system, it increases your collagen, removes the free radicals from your body. It increases the activity of phagocytes. Phagocytes are cells that engulf foreign particles and foreign microorganisms. It also increases your white blood cells that act as your booster for your immune system, the lymphocytes, and many other functions. Now, every bit of this is available in scientific literature. So it is not fair for anyone to withhold vitamin C in the treatment of acute infections. Please help to share this information And I hope it reaches the heads of nations and the policymakers or those who have the power to make these changes. Please help to save lives, help to prevent people from getting infected, help to reduce or avoid people dying unnecessarily when there is an effective, natural, cheap alternative available to us. Denying people who are infected of these natural alternatives is a cruel thing to do. I'm not going to be a popular man by saying this, but thank you anyway for watching. Send the message to everybody so that the message is loud and clear. It is time to speak the truth. Thank you again.